Welcome to this introduction to scientific writing for beginners. The objective of these lectures are to understand the principles of scientific writing, learn about how to do a draft of scientific articles for publication, and finally understand how to avoid common beginners' mistakes in these first drafts. Just with this introduction to scientific writing, you will not become a proficient scientific writer. In order to actually improve your skills and make a good first draft, you will need to engage with a supervisor who can guide you, who can revise your drafts, who can help you to spot your mistakes and help you to refine your skills in this field. However, this lecture will help you to start to make drafts which do avoid many of the common mistakes, so that only the fine-tuning and important bits can be focused on by the reviewer and by your supervisor and by yourself in order to make one good draft from the beginning. So let us start with just a general introduction where I want to just go through some of the principles that apply to all scientific writing. Okay? So you have to stick to the facts. You have to report the facts without judgmental formulations within your draft. You should stick to the required structure for your chosen journal. Every journal has slightly different ways of wanting presenting articles, and you have to choose your journal and stick to their instructions for this. And finally, you should also stick to some rules in language use when you report your results. This is especially important when you report your results as findings, that you do not overweight them, so that you keep them in perspective. And we'll come and go through some of these rules in these coming slides. So first of all, you have to be consistent in your writing, and this applies to everything you do in your article. There's sometimes decisions to be made, such as, for example, use of American English or use of British English. Some journals specify and say, we want American English or we want British English, but often they do not. Then you can choose yourself. But whatever you choose, you have to stick to it throughout your article. The second thing you should always be consistent with is the reporting of your numbers and your results in numbers, so quantitative results. You should always report total numbers as well as percentages. The usual way of reporting is the total number and the percentage in bracket. You can also do it the other way around, but whichever way you choose, you should stick to it. So either you say 18 patients and then you put the percentage in brackets, or you say 33.1% of patients and then you put the total number in brackets behind this statement. Okay, but whichever you choose, you should stick to it throughout your manuscript. Generally, you should always use abbreviations very sparingly. Some abbreviations, such as WHO, UNDP, are very well-known abbreviations, and they are accepted abbreviations, and you can use them with no problem. But then you come to these abbreviations where people might have different interpretations for them, and although you explain it at the beginning of your text, if the reader reads down your manuscript, they might have forgotten what you think does SAP mean. They might know it as something different. So if you look at SAP, RR, AA, and you think in your head, what do these abbreviations stand for? So SAP could stand for surgical antibiotic prophylaxis, but this is not something you would have thought of immediately. RR can stand for respiratory rate, but some people also abbreviate blood pressure for it. And AA can stand for a load of different things, such as acute appendicitis, aortic aneurysm, automobile association, and other examples as well. So it is always important in order to avoid confusion, to avoid such conflicting and confusing abbreviations. If you use abbreviations, though, you should stick to the same ones throughout your manuscript. When on the first use of any abbreviation, even the very well-known one as WHO, you should write the name of out in full and then put the abbreviation in brackets behind this full term, such as given down in these two examples, World Health Organization, and then you put in brackets WHO, or United Nations Works and Relief Agency, and you put in brackets UNRWA or UNRWA. And in that way, you make clear what you mean by it at first, when on first use, but thereafter you have to always stick to the same abbreviation for use. You should always think about the wording or terms you use, so that you can be clear about them and that they are not confusing. And be consistent with them. For example, in a survey you should not talk about patients or cases, because they are not patients or cases, but they are participants to your survey. And you should always use this term all through your article. In other fields, such as obstetrics and gynecology, it is often better to talk about women rather than patients or cases. As women, pregnant women, for example, are not necessarily patients, so they are not necessarily sick. They come for something normal. They are pregnant, they come for childbirth. This is not normal, and it shows and reflects that these are women of the public who happen to be pregnant or who happen to come in for childbirth. And you can also talk about birth instead of delivery, giving the term the experience that the woman has within this context. So basically what this means is, think about your wording carefully and think about the participants, the subjects of your research within this wording, so that you reflect their experience, that you have a patient-centered approach to your research, rather than a doctor-centered approach which looks at this research just from your perspective. Another important point, I find it very important, is that you should not use personal pronouns in your writing. I know it is actually used in many of the more recent papers, but good quality papers avoid using personal pronouns such as we, our, I, etc. Instead, you should let the findings talk for themselves. So I've given you some examples here. So in orange you can see what you shouldn't write, and in green there's an alternative that you could write. So for example, most importantly, we found poor adherence to guidelines. Instead you can write, this study showed poor adherence to guidelines. A second example is, we think different factors contribute to these results, such as. Instead, you can just say different factors might contribute to these results, such as. And in that way, you let the results talk for themselves. And this is a better way of presenting your results. Now let us move on to the structure of your article and your paper, and let us look at what is included in every one of these parts of the structure. So we are going to go through the title, the introduction or background. Some journals call it introduction, others background. The methods or materials and methods section, and again the name of it depends on the journal. The results, and in some journals it will be called findings. The discussion or interpretation, conclusion, reference, and declarations. Will go through all of these parts of this of the structure of your paper. The basic importance here is that you have to follow the journal instructions. So before you kind of finish and format your paper, you have to choose the journal you want to submit your paper to, and you have to follow exactly the instructions for authors that they have in all of these points. So you will find the maximum word count, you will find the structure they desire, you will find the headings you have to put. So do you have to put background, or do you have to put introduction? You will find some information about the abstract they expect, so the maximum word count of the abstract and the headings they want you to include in the abstract. You will find the format of the references they have, the declarations they need, and also and you have to follow these instructions to the letter, otherwise it'll just come back to you and you will have to make some changes to your first submission, and it'll just waste time. So let us talk about the title first. You find different sorts of title, of journal title. Or paper title. Some papers seek to make it an interesting title. Other papers seek to be descriptive in their title. And this is really, some journals want you to follow a certain title style. Many journals leave this open to the author, and it is a little bit depending on your preference, but generally the titles should be succinct and not too long, and this is better in order to kind of for people to find your journal and find your article and read your article. Okay, so some journals have instructions, and so for example you find they want you to mention the type of study that you are presenting in your paper. So for example, use of prophylactic antibiotics in cesarean section, a clinical audit, or cardiovascular risk awareness in the Gaza Strip, a cross-sectional study, unintended pregnancy, a mixed qualitative and quantitative study, infection control on 2 neonatal units in the Gaza Strip, report of a quality improvement initiative. So these all of these titles tell you all you need to know about your paper. They tell you what it is regarding, what sort of study it is you're presenting, and also some of them even include the location, the setting. This is also often a good idea to include. And these are fail-safe titles to your article. Sometimes you want to make it a little bit more interesting, and you could say something like treating patients in a safe environment, a cross-sectional study of patient safety attitudes among doctors in the Gaza Strip. Or you could make it, and here you have the phrase at the beginning that makes it a bit more interesting, but then you still have the description of what is actually presented in your article. Some journals leave it open to you which title you choose, but generally it is good to give an impression of what to expect from your article. And it is also always a good idea to give a location and the setting in your title, so the reader knows where this is, and this can also raise some interest in the reader. So let us talk next about the introduction or background. As I said before, some journals call it introductions, others call it a background, but the same thing is mentioned, is thought of in this with this wording. So let us think about what belongs into the abstract, how long should it be, and about the last paragraph of the introduction. All of these are very important points. So let us think about, firstly, what belongs into the introduction. The introduction should include a setting of the scene, with some background information about what is already known about your topic and why you chose it. So you have to give the rationale to your study. You have to make the reader see what it is important about your study and how it gives new information to what is already known in the field. It needs to be clear and well organized, and it needs to put into perspective what follows in the article, so that the reader thinks, oh, this is interesting, I really want to read this. How long should an introduction be? So this depends very much on the word count of the paper, but the more concise an introduction is, the better. Okay, so it is good to keep the introduction to a minimum and not have a long spiel of introduction, making the reader tired before they come to your results. Okay, so usually this should not be longer than one A4 page, or even less. And it has to include important references from the field which are already known. So from the field of the literature you review, of the topic you're writing about. The last paragraph of the introduction is very important. Why is it important, and what should it include? So the last paragraph of the introduction sets out the aim and the clear objectives of your study, so that everybody reading your paper will be able to find your aim and objective of your study, to kind of know what this is going to be about. Okay, so you make your rationale clear in the first sentence of the last paragraph. For example, little is known about unintended pregnancies in the Gaza Strip. Or you say, so far no study has examined the cardiovascular awareness of the Gaza population. And following this kind of rationale that made you kind of choose this topic, you set out the aim for your study clearly. You say, therefore, this study aims to, therefore, this study explores the, or this study evaluates the. And you will see here in these sentences, setting out the aim, you can see that it does not say this study will identify, this study will assess. No, you see it aims to, it explores, it evaluates. So the word choices are not so rigid and not so definite, because identify, this is often not possible to make a last kind of identification, to identify something with one study. Often you need repeated studies and different studies from different places and contexts to be sure about the finding of a study. So you need a study and you need a replication of that study result to be sure, because every study, everything you do has inherent biases, and therefore you have to tone down the kind of significance of your findings. So let us go and talk about the methods next. Once you have set out your aim and objective, you can go on to the methods. The methods have to be described in a way that any reader of your article can replicate the methods you applied to your study. This is very important. So you have to be very clear and about what you did and how it was done, so that it can be replicated by anyone. This also includes that you include in your submission, usually as additional files or supplementary files, the research tools you used. So, for example, if you have a focus group interviews, you use the question you gave to the group. If you have a survey, you use the questionnaire that was given to the participants, so that people know what was actually done and used. So what needs to be included in this passage of the methods? You have to describe the design of the study clearly. You have to be very clear on how your sample was recruited, with inclusion criteria and exclusion criteria. You have to report the outcomes you were looking for, primary outcome and also secondary outcomes if you had some. You want to describe the measurement of outcomes. So how were they measured? You have to be very clear about the data analysis and the statistical tests you used in your data analysis. Most research has missing values, and you have to describe in this passage as well how you dealt with missing values. And finally, if you had several steps as part of the study, you could think about adding a flow chart to illustrate them. This is also sometimes good if you have a sample, a large sample. You start out with a large sample and then you reduce the sample by several steps. So, for example, you have a sample of 1,800 participants and then you exclude 300 because they didn't fill out your survey properly, and then you exclude another 150 because they are under 16, and so on. And in this way, you will and then you arrive at your final sample size. And by illustrating this in a flow chart, you can sometimes make it very clear to the reader how you kind of arrived at your final sample and how you applied the inclusion and the exclusion criteria. Here I have two examples for you for other flow charts where you have different steps in your research. So, for example, in this research, you had a phase 1 where you did assessment of knowledge. Then it was followed by a phase 3, training and education, and then a phase 2 with training and education, and then finally a phase 3, which was reassessment of knowledge. Okay, and such a flowchart makes it very clear what you mean by your different phases. This is another way that you can kind of show, for example, that you can illustrate how you apply different interventions. Okay, so for example, you have the baseline assessment of knowledge of staff in hand hygiene. Then you have intervention 1, which was introduction of guidelines, and you have another assessment of this of knowledge of hand hygiene in staff. And finally, you have an intervention 3, which is training of staff in the guidelines. And following this training, you have another assessment of knowledge and practice. And in this way, the reader is very clear on what you mean by intervention 1 and intervention 2. Okay, so in addition to this, stating this in the flowchart, if you have interventions, you have to be very clear on describing your intervention. Okay, so you have to be very clear what intervention was done and describe it very well, so the reader knows exactly what was done and they can do the same intervention if they choose to in their unit. Another very important part of the methods is the statistical analysis. Here you have to clearly describe the statistical analysis that you applied in your paper. You have to say what was the statistical significance, so the level of statistical significance that was agreed, which usually is p 0.05, sometimes it's p 0.01. I want to give a slight warning, though, about these levels of statistical significance. Instead of just saying the level, it's also always good to actually illustrate the effect of your intervention or your intervention by giving the actual numbers. So the numbers and illustrating the change that might have been seen or that hasn't been seen within your groups. This is important because you can then, because the level of significance p 0.05 is arbitrary. It's just chosen out of the blue. It doesn't mean that if you have p 0.05 or 0.06, if you have that there's no significant findings here, clinically significant findings here. So, and the same is true for if you have p 0.01, it doesn't necessarily mean that you also have clinically significant findings. Although maybe the numbers are significant, maybe actually in practice it's not that significant. So you have to always describe your findings in this context, and you have to always give the level of statistical significance that was agreed. The software used for analysis is mostly also reported in the method section, but it's not actually that important to include it. It can be included, but it's not the main part of the method section. The main part of the statistical analysis section is to describe exactly what tests were applied and how they were used. Another important part of the method section is that of ethical approval. Sometimes it's called ethical considerations. This is very important to kind of do before you even start your study. Any study, including patients, patient notes, families, or interventions, needs ethical approval. If you have a survey of the public or staff, ethical approval is not always needed, but if you are in doubt, it's always better to get it. In fact, many journals nowadays ask for your approval. And if you have not got ethical approval in your study, you have to explain why didn't you get ethical approval. If you state you have got ethical approval, you have to add the name of the review board that gave you the ethical approval, and you have to also the ethics committee that gave the approval, and you should give a number that was given to you with the approval. Sometimes there's no numbering system, but there's only a way of keeping the approval as titles, by title for your research. And then you have to say there's no number of the approval, but it's just given to it. It's filed under the title. So it's very important to be very precise in this and very correct in this chapter of your research. Some studies, such as quality improvement studies, especially those that use auditing, do not need formal ethical approval because there are more of an observation of an intervention which was done anyway. The intervention has been done, and all you do is you report what the kind of impact of that intervention was. But it might still be, it might, so in these cases, it might be enough to get the institutional review board approval for your study. Another important point within the ethical considerations chapter is that of consent. If you have participants in your research, you will need consent to your research. So all studies that include patients also need to include consent. Verbal consent can be obtained, for example, if there's surveys, because filling out the surveys, completing the form is also seen as a consent, especially if the patient is not treated by you in your department. But it is better if you get a formal written consent. It's always better to get a formal written consent from the patient. In some cases, when you have online surveys, you can give a tick that I agree to participate in this survey, and then they can say yes or no and give one tick, and only if they say yes, they then complete the survey. Prior to getting consent from patients or participants in your research, you need to explain the research to these patients. You need to explain the purpose of the research and the nature of the study, as well as the impact this study might have on the patient or the participants. So some studies have little impact on patients, such as filling out a survey, maybe 15 minutes, and then that's done for them. Others have very significant impact on them, and I'm thinking especially on intervention studies, when maybe one is randomized controlled trials where new treatments are looked at, and you can be the participant can be randomized into a treatment or control group, and this might have a significant effect on them. So it's very important to explain these things to them, and so they know what they let themselves into. And of course, this is saying naturally spoken, consent has to always be given freely, voluntarily, and without any pressure. Another chapter or paragraph is very often needed now in the method section, which is public or patient involvement. And here they mean how far have you or what efforts have you made to involve the public and or patients in planning your study, in conducting your study. How actively have they been involved in this task? Generally, I have to say, we are not that good at it. So generally, researchers do not always consider the patients in this mix, but we often come from ourselves. We are often dominated by the researcher question. So you think, I want to know if A leads to B, and then you design your study like that. But maybe the patient is more interested if A leads to C. And this has to be, and it is a good practice actually to start involving patients in planning your research and getting some feedback from them, what's important to them. So higher profile journals do usually ask for this, what have you done to involve the patients? What efforts have you made? The second thing is that journals often want to know is, how are you going to feed back the results to your participants? So especially if you put your participants through some hardship, or if they had to make some efforts to participate in your research, how are they going to find out the results of your research? And this is a good thing to think about when you design your research. How can you feed this back to the participants? It helps your research to achieve greater impact, and also it helps maybe to be more prominently seen on social media and also by publication. Okay, now we come to the next chapter, which is the results. And of course, this is very important again. Generally, you should not report methods in the results section. So the methods have to stick to the methods, and you only want to report your results in the results section. It should be clear and concise, and usually it employs the use of some tables and charts or figures to help to demonstrate and illustrate the results easily and clearly, so that the reader understands them easily. In these tables, for example, a reader should be able to look at a table and understand the table without reading the text. The table has to be self-explanatory. You should not repeat in the text what has already been demonstrated in the table or the chart. And you have to make sure that all of your charts and tables that you use in your article are also actually referred to within the text, so that they have a reason to be there. On this, especially the use of tables and charts or figures, you have to follow the journal instructions. So here the journals are very different and they give different instructions, and therefore you have to follow the journal's instructions, how to present them and how to format them as well. You should never be tempted to add a table or a figure for results that can be more easily explained in writing. Okay, results that are explained in one sentence or two sentences do not need an extra table or figure for themselves. Now we come to the discussion, and the discussion is the crucial part of the article. It should be concise, but include the important points that you found in your research. You should never, and this is very important, repeat results in your discussion, except for one point when you start your discussion with one short paragraph where you summarize the most important findings of your results very briefly. So you only in one paragraph you summarize these findings within, 3-4 sentences, and then after this one finding you should not repeat your results, because here you want to discuss the results and not repeat the results. You have to do a proper literature research before you can start your discussion. So because you have to look, usually the discussion includes a part where you put your findings in the context of findings within the field, other findings within the field. Generally, you cannot make claims without giving a good reference for them or support them by your own findings. Generally, the discussion should definitely reflect your findings, okay, your results. Okay, so with the points you make with in your discussion, you should show how your results actually lead you to kind of come to these conclusions or these points. And you can also use other literature, again, other references to underline these points. Generally, and I've said this before, generally you have to remember that any study, no matter how carefully it is designed and conducted, will have biases. Biases cannot be avoided completely. You can be aware of potential biases in your study design, and you can, from the start, work to reduce these biases, but you cannot avoid them completely. Therefore, your findings are important and you have to give them the importance in your discussion, but you cannot make them too conclusive, because you have to remember you might be wrong in your points, because you might have not considered a strong bias in your study. So you should tone down the findings you have in your discussion. You should tone down the conclusions you come to in your discussion. For example, you could say it like this: This study shows that hand hygiene practice can be improved. Not instead of saying hand hygiene practice will be improved, you should say hand hygiene practice can be improved. Or you could say something like, therefore, education and training of staff might be key to improving. So instead of saying education and training of staff will improve hand hygiene practice, you should say might be key to improving hand hygiene practice in staff. So this is a very important principle you should always apply to all studies you do. The discussion needs to also include a paragraph on strengths and weaknesses of your study. Often this is introduced to the discussion at the end as the last paragraph before the conclusion. You should have 1, 2, 3 statements on strength of your study, but also very importantly and more importantly, you should state the weaknesses of your studies as well, and especially those that might influence your findings. In this paragraph, you can then also describe ways that you might have employed to reduce such weaknesses, so to reduce the bias that might lead to weakness in your study. Not all journals want a conclusion at the end of their discussion. So many journals actually they want a conclusion with a concluding paragraph which is also titled conclusion, but not all do specify that they want a conclusion. Even if they do not want a conclusion with their title, it's good to put in a concluding paragraph. This concluding paragraph should consist of 3 to 4 sentences with your main findings and main points that you want to put across and show with this article. And this should be the take-home message for the reader. So it is very important to be very concise in this and very clear in this concluding paragraph. The abstract is a summary of the article. So the conclusion is not a summary of the article. I want just to show the difference here. The conclusion is only a few points of the take-home message, the most important points that came out of your research. The abstract, on the other hand, is a summary of the article, including background, methods, results, and conclusion usually. Finally, we will want to get to the references. Here it is very important to follow the journal style to the point, the way they want to have it. So this can take some time actually to get it right, but it's very important to get it right. You should cite the article and text correctly. So you have to be sure that you give the correct reference to the points within your text. And you should make sure that all references that kind of appear in your list of references are also actually referred to and cited in your text. You should be sure to make a good literature review. So you should include the main relevant articles on your topic, and you should also include up-to-date references. So not only references more than 10 years old, but you should actually, the majority of your references should be less than 10 years old. Some journals have a maximum number for references to be included, and you have to look at that, obviously, when you actually choose the journal to once you have chosen the journal you want to submit to, you have to make sure you know how many references they want. Generally, journals do use software to check the references. So to check if they are complete, if they are correct, if they are traceable, and if they find too many mistakes, they might reject your paper without any further consideration. it is very good to get used to using reference citing software. One example is EndNotes. There's also Mendeley. There's many other software options here as well, because this helps you to be flexible for your with your references, so you can easily change the style of your references. If you've kind of prepared and formatted your paper in hours long work to submit it to one journal, you submit it, but then you are rejected from that journal, you want to try another journal, and they might have different rules for their references. The reference citing software allows you to easily change the style of references necessary. It also allows you a very easy way to cite while you write, so that you can, as you write, you can cite the relevant articles within your journal, which makes it much easier to use. Some journals want you to use checklists and submit them with your submission. Even if they are not, if your journal does not require you to submit a checklist, a completed checklist, it is often a very good idea to use these checklists. They help you and remind you what all has to be included in what type of depending on the type of study and the study design you have employed. There's many different checklists, and all journals will have a copy of them in their submission for author section. And these checklists have different names depending on the study design you employed. For example, Consort is a checklist for randomized controlled trials. Strobe is a checklist for observational study. Prisma is a checklist for systematic reviews. And there's there's Squire, which is a checklist for implementation research or quality improvement research. And there's more different other checklists as well. I just wanted to give you a flavor of them and to encourage you to use them, because they will remind you of what you need to include in your article to make it good. And the better your article is in first submission, the easier it will be to get it published as well. So let us now just review the most important points of this long lecture. First of all, follow the journal instructions. Be concise and clear. Whenever you can say something in less words, choose to say it in less words. Okay, if you can say something in less words that you can also say in more words, use less words. Be clear and consistent when presenting numbers, abbreviation, and in language use also throughout your paper. Minimize the use of abbreviations, and set out a clear rationale in the introduction to formulate your aim clearly, or your research question. So this has also be clearly presented in your introduction. Describe the methods so that they can be replicated by a reader. And again, be clear and concise in the description of the results. And include well-presented tables that can make it easier for the reader to actually understand the results and get the results. Make a well-structured discussion. Do not repeat results in the discussion, and end your article with a concluding paragraph which gives the reader the take-home message from your research. These are only the most basic first kind of steps in drafting your manuscripts. As I said before, in order to become proficient in scientific writing, you need a lot of practice. And with this practice, you will need a supervisor, work together with a supervisor who will give you critical appraisal of your writing and will help you to improve manuscripts, so that with time you will learn what to include, how to include it, what to do, and what to avoid. Another important step in this, on this journey to becoming a researcher and writing your own scientific research, is when you actually submit your work to journals, you will get usually a review, a peer review. And in this peer review, you will be able to find many points that you didn't see when you submitted the journal, the article to the journal. You will get many points feedback, and you will get also to improve these points, so that in the end you improve your manuscript and make it better than the manuscript you first submitted to the journal. And by doing this peer review, going through these peer review points, you will also learn and improve your scientific writing skills with time. So I do encourage you that you cannot learn scientific writing just by watching lectures. You can only improve your scientific writing and become proficient in it by actually doing it, by practicing it. So the expert in anything was a beginner once, and this is also true for scientific writing. I hope this lecture was helpful to you and to accompany you on your first steps to scientific writing. I will. You can also look at the other lectures on choosing a journal or doing implementation research or other ethical considerations within the research field. Thank you very much.